Adults with disabilities have higher rates of chronic conditions than the general population. The objective of this study was to examine the risk of any and specific potentially preventable hospitalizations, in short, PPH, for adults with cerebral palsy or spina bifida, congenital or pediatric onset conditions. The main takeaway message from this study is that the risk of PPH or potentially preventable hospitalizations was more than 4 times higher in adults with pediatric onset disabilities than in the general population. It was particularly high for preventable hospitalizations due to chronic obstructive pulmonary disease or COPD, asthma, pneumonia, and urinary tract infection. Annual wellness visits substantially reduce the risk of PPH for everyone and for adults with pediatric onset disabilities. My name is Elham Mahmoudi. I'm an associate professor of health economics at the University of Michigan Medical School in Ann Arbor, Michigan. The study's title is Potentially Preventable Hospitalizations Among Adults with Pediatric Onset Disabilities. Let me give you an overview of the study. We hypothesized that PPH risk is greater among adults with CP or spina bifida than among the general population. To conduct the study, we used 2007 to 2017 national commercial insurance claims data for the study. Using ICD-9 diagnosis codes, we identify adults with pediatric onset conditions, specifically, again, cerebral palsy or spina bifida, and propensity match them as our cases with people without disabilities as controls based on age and sex. Our final cohort includes about 21,000 adults. Half of them were among our cases and the other half in our controls. We used regression modeling, adjusted our models for age, sex, race, ethnicity, health indicators, and socioeconomic variables. It was a longitudinal study in which we followed our cases and controls for 4 years. Our results show that adults with CP or spina bifida were at 4 times higher risk for any PPH, 1.9 times higher at higher risk for PPH due to COPD or asthma, 3 times at higher risk for PPH due to pneumonia, and 6 times, I'm emphasizing 6 times at higher risk for PPH due to urinary tract infection. Cases and controls with annual wellness visits had lower PPH risk. It cut the risk by almost half. In conclusion, I would say adults with pediatric onset disabilities are at greater risk for PPH or preventable hospitalizations, providing better access to preventative care and health promoting services, especially for respiratory and urinary outcomes, reduces PPH risk among this patient population. Findings from this study have salient implications to improve clinical approaches for these patients with disability in general and patients with pediatric onset disabilities. We should encourage and promote use of preventative services for this patient cohort. We need to make preventative services more accessible for individuals with disabilities. We are currently examining interventions using the best practice alerts or BPA in Michigan medicine by being proactive as a healthcare system. Our own research and the work of others show that people with disability are at higher risk of adverse health events such as PPH. Primary care and family med should prioritize chronic and acute care screening for this patient population. This can improve the health and well-being of these individuals and reduce wasteful and non-value-added healthcare spending. I encourage everyone, providers, researchers, policymakers, and individuals with a disability to read the article. It will be published in the December issue of the Mayo Clinic Proceedings. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.